palpation here in Toronto with Dr. Spina. You can ask me a few questions today. Doc, all right?
Good, thanks.
So one of the questions I get a lot regarding the in-season training is a lot of issues come up with our athletes and it has to be with soft tissue. What would you think is the #1 treatment option for these athletes, and what are the common areas that you find that you need to treat for hockey players specifically?
Well, the #1 area that I would say that hockey players, that people that are treating hockey players would have to focus on assessing would be their lateral chain, only because hockey is predominantly a coronal-based sport, so their movement patterns are about pushing out to the side, as opposed to a runner who has more sagittal plane necessities, meaning that all of their force has to be driven towards going forward. So with hockey players, with regards to their skating, and then it even goes into their training, let's say that they're jogging or if they're lifting, they tend to really favor the glutes on the outside, and they favor that kind of coronal-based motion. So those tend to be the areas that accumulate the most amount of fibrosis or scar tissue. So like we were talking about during the seminar, one spot that is really common to find a lot of fibrosis is just along the lateral gluteal fascia, where the gluteus maximus insertion meets the bicep femoris meets the vastus lateralis. That area is where most of that push-off strength is going to occur, so that is a really common area to accumulate soft tissue fibrosis that can be detrimental to the biomechanics of, let's say, the stride.
Speaking of which, we do find with our athletes, hip mobility is generally limited in hockey players. You had a great definition of what mobility is, and I kind of want to tie that into another question that I get a lot is, how do you feel about yoga for hockey players when it comes to performance as in increasing their flexibility?
Yeah. There's a belief out in the medical community as well as the training community that flexibility is a worthwhile goal, or is something that should be attained as it is thought to enhance performance or decrease injury. Now we know from the literature that flexibility and stretching specifically does not decrease the chance of injury. And the concept that flexibility will help performance doesn't really make intuitive sense. Flexibility is the ability of an articulation to achieve a range of motion passively. So, for example, if you're passively doing the splits or you're passively sitting in a stretch, just because you can passively achieve a particular range of motion in a joint or an articulation, it doesn't then translate into your active ability to utilize that range of motion in a functional movement pattern or in a particular sport-oriented movement. There's a difference between being very flexible and being very mobile. Whereas flexibility is the ability to passively achieve it, like we just said, mobility is flexibility plus control, or flexibility plus strength. So in other words, to achieve great mobility means that you are able to capture all of your passive flexibility. So if you can put your leg out to 90 degrees, it doesn't really matter if you can do that passively. What matters is, of that 90 degrees that you can achieve passively, how much of it can you control? And that's where the definition changes from flexibility to mobility. Flexibility is getting your leg to 90. Mobility is being able to control all of that 90 degrees of motion. And that's where that's a more worthwhile goal, the active goal of trying to improve your mobility. A healthy joint can be too flexible, but a joint can never be too mobile, because mobile insinuates that you have control over that joint. So if you wanted to have a joint that had a great range of motion but maintained stability, increasing flexibility won't help you with that goal. Increasing mobility will. So with regards to yoga, yoga is mostly a passive flexibility technique. They do have some poses that do demand some muscular training. However, you know that in order to develop strength, you really want to be working at about 80% your maximum voluntary contraction. So just holding a static position really never gets you to the point where you're strengthening the ranges of motion. So yoga makes you really good at yoga, and it makes you really flexible, but I don't necessarily think that that's going to translate into a better hockey stride or into the ability to utilize increasing ranges of motions more efficiently or effectively.
Doc, is always great information. Maybe just let everyone know where else we can find some great information on your blog.
Yeah, my blog is functionalanatomyblog.com. You can learn about all of my systems from assessment to treatment to rehab and conditioning. You can join us on Facebook, facebook.com/functional anatomy seminars. If you're interested in the seminars, functionalanatomyseminars.com, and you can follow my Twitter at Dr. Andreo Spina.
Awesome. Thanks so much, Doc.
All right.
Appreciate it.
No problem.